the big one. That's big. There you go.
Yeah, that's what I'm here
Great.
Thank you.
Default settings. Okay, it's supposed to be. All right. So can someone make a motion to start this meeting? All right, thank you, Bonnie. Can I have a second?
It is board and
All right, thank you, Gloria. So welcome to the strategic planning session and service and recognition observance. So my name is Ann. I'm from Maui, and I'll introduce myself in another moment. There's breakfast, there's yummy bananas and banana bread and some other little delicious looking thing in a cup. So please eat. The bathroom is right there. What is the password? It's on the table. So if you need to use Wi-Fi, it's right there for you. And then I don't believe we have anybody attending remotely, do we? Oh, a board member?
Roberta online.
Okay, well, so all you guys online, we just ask that you keep your mics muted until you speak. And then please turn them on so we can hear you. So where are they? Where's the camera so I can?
You want to see their faces?
Yeah, no, I know, I just want to wave to them and read them.
Right over there.
Okay, so this is a formal meeting, so in my greatest formality, I will proceed. So aloha, board members, guests, HSCN staff, you know, it's almost easy for me to say, oh, I say so. Agree. And members of the public, welcome to the 2022 Advisory Board Meeting Strategic Planning Session. We're excited about today's meeting, really. And look forward to today's business. We're working to pivot our meeting so format in keeping with recent changes to the Hawaii Sunshine Law. That's a law. And the hybrid meeting format. As such, we'll pivot to official roll call, prompts for public testimony, and announce the time at the beginning of each agenda item. So pretty minor, not too bad. So here's the opening statement about a testimony underneath the Sunshine Law. Any interested person may submit testimony in writing to the board on any agenda item by regular mail, email, or fax. An individual or representative wishing to testify in person should register prior to the start of the meeting. Testimony must be related to an item that is on the agenda, and such person shall be required to identify the agenda item to be addressed by the testimony. Submit testimony by one of the following methods: email to hscfn@hawaii.edu, fax to 808-956-0547, or mail to the Hawaii State Center for Nursing Advisory Board at 2528 McCarthy Hall, Webster Hall 402 in Honolulu 96822. Each individual is allotted 5 minutes, more amount of time otherwise designated by the chairperson, which is however much time you need, to provide testimony to the board. So at this time, we're going to do a formal roll call. And Charter chair here. Bonnie Castonge here. Thank you. And please orally say here, so for the recording. Linda Beechner here. Thank you. Gloria Fernandez here. Roberta Haley.
Present.
Thank you, Roberta. Rose Hada here. Arthur Sampaga has been excused. He's on the road. Doreen Nakamura. More. Julio Zaparipa, coming soon to be here. Clementina Seriula.
Here.
Thank you, Clem, and Laura Reichert. So great, you all. So we have 2/3 of the board members, so we can vote on anything. We do have special guests, who may attend sometime during this day as part of the service and recognition program. And they are, our Governor Ige, Senator Jarrett Keokalo, he can try to say Sharma 20. Representative Brian Yamani, Nancy Atmospheric Welsh is traveling too, right?
She's going to Hawaii.
Yeah, Beth Hoban, Susie Lee. And I read those names to again say they have been very instrumental and supportive of the center. So this is a day to honor them. And then we have a very cool speaker, Sherry Daniels, who's currently on Maui, who you're gonna love, and she's gonna join us from New Zealand. Okay. So does everybody know each other here?
Roberta, Linda, and Victoria, and board members. They might be familiar.
Okay, so why don't we do at least that? Can we please have you guys introduce yourselves for the joy of us all, or maybe we should just quick run through everyone, because maybe you don't know us. So why don't you start, Linda?
I'm the executive director and current vice president of Hawaii Nurses Association, which we began 3 years ago. Brought back to Hawaii. I'm also a nurse practitioner, although I'm trying to retire from that. And Hawaii AMA.
Thank you for doing that.
Volunteer.
Doctor.
I am responsible and I am the director of the I'm Laura Reichert, the director of the. I'm Catherine Davis. I'm here today as the associate director of social nursing, early
I'm Carrie Olivera. I'm a nursing workforce researcher at Center Nursing.
And a good one at that. How about online? Roberta, can you introduce yourself?
Hi, I'm Roberta Haley, and I'm the Dean of the School of Nursing and Health Professions at Chaminade University in Honolulu. And I also wanted to mention, Anne, I can hear you clearly and everyone else is garbled.
Oh, here we go.
transmit into that.
Okay.
Okay, well, I can barely hear. I feel you. Thank you, Roberta. Clem, everyone should know you. What would you mind?
Good morning, everyone. My name is Clementina Sergio-Uleb. I'm the interim dean of the University of Hawaii at Manoa, Nancy Atmospheric Welsh School of Nursing.
Awesome.
Thank you.
Is there anybody else online? No. Okay, this
Bree has introduced herself.
oh, Miss Bree, the brand commuter.
Bree Atwood at the top screen. I'm going to kind of nursing and board support and recruitment and retention programs.
All right. You know, it's an amazing crew that Laura pulls together. People from all different realms. So here's another sunshine law treat for you. This is the statement on public testimony. Individuals who are unable to provide testimony at this time will be allowed an opportunity to testify when the specific agenda items are called. For both internet and phone access, when testifying, you will be asked to identify yourself and the organization, if any, that you represent. Each testifier will be limited to 5 minutes of testimony per agenda item. All written testimony submitted are public documents, therefore, any testimony that's submitted orally or in writing, electronically or in person for use in the public meeting process is public information and will be posted on the board's website. So that means no swearing.
What? I have to leave that.
So to start the day, here is just a quick overview of the agenda that we have. We're gonna hear from Laura, who's gonna talk about the progress on our current strategic plan. Then we're gonna hear Dr. Daniels, who's gonna talk to us about using business strategies. And then we're gonna do our recognition. We'll recognize the champions, and then of course we'll eat lunch. Okay, so now here comes a really fun part. These are the comments by the chair. That's me. So I'm gonna pretend that I can read this on my phone. Which should be, because I wrote something else, but I couldn't print them. So I have weak tech at home because my husband is in Seattle. So, and plus, you know, I don't like, do you guys work at home? You know, I'm just so ineffective at home. I pet the dog, I do the laundry. Okay, so aloha to all and welcome to the Hawaii State Center for Nursing Advisory Board meeting. It's great to be back in person, right?
Yeah.
And it's an honor for me to lead this meeting in my new role as chair. I'm a professor of nursing at Maui College. I just finished 10 years as the department chair. And the Center for Nursing has been so important to Maui College, as it is for our other nursing programs, for our healthcare organizations, and for the nurses who work here. We are so, I'm not going to say lucky, you know, it's very strategic. And I think we have to harken back and thank Mary Boland. You know, how this got started, but the,
Before Mary Boland's time.
is that right?
2005, with the law.
Who was it?
Management company.
Wow. Well, let's just recognize her right now. Thank you, Nancy. Having this dedicated, centralized entity working on our behalf to collect and analyze data, articulate the issues on our behalf, and bring the stakeholders together to address the nursing workforce issues in Hawaii. It's such a benefit, both to us who work in healthcare and even our citizens who don't even actually know how this trickle down is helping them. So this year was a big one that Act 66 passed. It's the first time that the nursing fees have been raised to increase the revenue for the center. So this is essential both to keep the work that's going on now and to allow to grow. Because I think we all know that the environment we're facing is not easy. It's more challenging yet. So today, Laura's gonna show how powerful the work that's been done as she goes through all our strategic goals. And I think everyone can't just look at it too academically. These are really actual changes and effects that have happened. And we need to soak it in and realize if you can do that, you can do the next level. What I really want to do is thank Laura and Carrie, Bree, Catherine. I'm gonna read this. For their brilliant work and endless effort on behalf of Hawaii nursing. They have repeatedly used data to inform, build coalitions and consensus, and have measurably moved the needle on the issues that affect us directly. The Center for Nursing stands as an example for the centers in nursing in the whole country. Other state centers look to you guys for strategies and programs. I cannot overstate the talent, the expertise, the hard work, and the efficaciousness of this team. Mahalo from us as a board and on behalf of all the people who serve.
Thanks, Anne.
Yeah, no. It's big, it's big, but we are not done. We're short of LPNs, RNs, nursing faculty. We need more APRNs. There's this whole shift in nursing workforce where retention is becoming a horrible problem. And there's an obvious and an increasing and a never to go away need to address nursing well-being in a holistic way, not in a platitude way, not with a piece of cake or 20 bucks. So these are big issues. But this is a quote from Bree. With great challenge comes great opportunity. Today we'll consider our next steps. We'll review what's been done. Dr. Daniels will give us some new strategies, and then we'll take some time to think about what's going forward. Finally, we'll do our recognition. So without further ado, let's welcome Laura.
Nice socks, boss.
Oh, you're welcome. They say inhale and exhale, so please remember to breathe today.
If you have a bad look on her face.
I'll just remind you to do which one. Thank you so much, Anne, for the very kind and also very thoughtful words that you started us off with, and for being our chair. I think it's so important. I have been around sick kids all week long. Okay, is that better?
Yes.
All right, yeah, I don't want to take my mask off because as the director of the Center for Nursing, I feel like it would be a really bad outcome to get you all sick because my children are infectious people. So I will talk louder and I will talk in this direction, I think, so you guys are receiving my. All right, can we go next slide? And the next slide again. So we're going to review the strategic plan, and I'm going to compare it. We're going to look at the strategic plan, and then we're going to look at where we are today. So we're going to be doing the year in review, but also a full overview of where we started in 2018 when we launched these plans to today. And this is a very high level overview. So for the staff, please know that so many people are left out, and it's not that they're not important, but when you go up to 30,000 feet, you know, we can't see people's eyelashes, so we lose some detail. Next slide. Strange enough, I'm sorry. All right, so this is, I am recognizably not legible, but all of our goals and the mandates are on the left side of the screen, and then we had quite a number of objectives that we hoped to achieve over the 5 years that we set these strategic plans. Our goals overall were to improve the evidence base of our work and to be more data informed in all aspects of our work. And then from there, as we learned new information and we gained more longitudinal information, more longitudinal data, then the goal was that we could say, oh, we can put this down, or we can pick this up, or maybe we need to merge these activities. And clearly that goes really well when we have a pandemic and then nothing can be put down. But we've done a really good job responding to these goals and objectives, and achieving these objectives. Next slide. So the first objective is our state mandate, our first state mandate, and it's related to nursing workforce research. The top, so on these slides, all of these slides with the grids, everything on the top row were our objectives. And the bottom row is kind of our snapshot, single post-it note of what we've done to date. So we wanted to continue the nursing workforce supply and educational capacity survey. We have sustained that effort. Importantly, the education capacity survey has been revised to be more responsive to nursing program needs, including providing every school every year with a school to the state report so that they can use that when they're applying for grants or when they are or when they're writing their accreditation or when they're doing anything that they need to demonstrate their unique impact. So we're providing that data to them. And then Carrie also will send them any other data that they need. We also revised the supply survey, and for the first time in 2021, included questions about wellness, and also we quickly improved the survey related to parents. So better data and more accessible data. We also wanted to determine the future, the projections for nursing workforce needs. We are not capable of doing that within the Center for Nursing for so many reasons. We did a cost analysis, thank you, Carrie, for doing that. It's going to cost about $10,000. There are projections that are canned that we can just apply. Those tools are really dependent on a lot of other things. And all of those data points don't necessarily exist in an accessible way. So what we can do is leverage our data to support other people who are doing that work. And so HAH is working on that, and we are a strong partner with that. We have really, really improved supporting nursing through accessible data. The data is far more accessible than it was in 2017, 2018. We have infographics, we have webinars, we have dashboards, we have reports, we have snapshots, we have information briefs. We are talking to people about all the things all the time. And when we talk about what needs to happen in that state, we talk about being data informed. So people understand that these are not opinions, which is so important because you can't just do something because it feels good or it sounds right. It has to be right. We don't have enough tolerance in our state to get it wrong, particularly right now. And Carrie and Leanne are like this wonder team of infographics. Bree has like an incredible amount of data with her program and clinical placements. Catherine and again Leanne are able to help nurses understand how to crystallize information through evidence-based practice. They're able to make it tangible, which is not necessarily part of this mandate, it's the next one, but also important. And then we have a nursing workforce research steering committee. It was important to us to have our advisory board, but we also needed to have subject matter experts who are informing individual groups. So that's not part of the advisory board, but informs the work, and then we bring that work to you. So all of that work has been sustained. I really feel like over the past 4 years, we have really met this and probably exceeded what our legislators and nurses imagined would be possible. Oh, I can do the next one. You do the next one. Okay, so our current direction is to emphasize the key findings. So really doubling down and continuing the path that we're already on. I think we're in the right direction. And people, yesterday I was on the phone with Colton Rainbow and he was like, I printed off the information that Carrie gave me and I read it all. And oh my goodness, he was just gushing over the quality. And it was a draft, like it was not a final product. But people are so emphatically appreciative of having this information and they know that we are a reliable source. Okay, next slide. The next one is conducting research on best practices and quality outcomes. And I think for a long time, we've struggled with this one because it's a little bit weird phrasing. We're not conducting research in the academic sense of research, but in the legislative sense of research, where it's like, hey, can you find out more? We are certainly doing that. And so I want to frame this mandate in that context. This is not mandating scholarly pursuit. It is mandating be informed about best practices and quality outcomes. For so long, we have had the evidence-based practice workshops for clinicians, for educators, for leaders. Instead of continuing that, in its current form, we took this year as a pause. We've had this program for 10 years. It is resource intensive and it's not necessarily scalable. And that has been a really big challenge that Catherine has been grappling with because she wants evidence-based practice to be accessible, to be scalable, to be practicable, to be practiced. And so, you know, it takes a lot of consideration about how to provide something, particularly she acquired this program. And we have had so many changes. Between 2019 and today, technology and the ability to educate remotely and at scale has just completely changed, but also the programs, the tools and the equipment and the needs and the attention in our communities have really shifted as well. So she's free. Every time I see her, she has a book about evidence-based practice that she's reading. So we made this choice to assess this program sooner than our strategic plan, but it was really appropriate for our environment. Particularly because our strongest partners in this work is on Oahu, which means that we are not serving our neighbor islands well enough. And I think that's the point that Catherine always comes back to. And then we have such challenges in long-term care as well. And over the course of 10 years, we've had incredible growth nationally of strong educators and champions in evidence-based practice. And so how can we partner better with our national resources? That goes to, the next is promoting evidence-based practice to nurses and healthcare leadership. And I just described that whole investigation process. That's really what Catherine's doing. So instead of revising, she is investigating how to promote this work. In terms of investigating the center's role in offering continuing competency, we are now an accredited provider of nursing education through the American Nurses Credentialing Center's Nursing Professional Development Council on Education, I think it's called. And we are accredited through 2025. And so we are able to sustain that work. We're always doing process improvement in terms of how we are running this program, as well as what topics and what organizations we're partnering with to get that information out. We're starting to explore joint partnerships. A lot of people are doing really wonderful education without providing CNEs, and they want to do that. So we're exploring how to have more gains through natural partnerships. And then we also launched the Success Phase and the Hawaii Simulation Collaborative. Those are initiatives that will make continuing competency activities more accessible. So simulation is a strong tool that is being used both in education and practice, and the simulation technicians, how do we call them? Educators asked to have that group reconvene. They were previously meeting, but also coordinated by the center. So they asked for our assistance in that. We are doing that. And then with Success Phase, we are making certification more accessible, that AMCC certification. And then looking at the trend of how this mandate was going, we actually revised our academic progression in nursing work group, and we renamed it as Nursing Professional Development Council, because our partners were not just asking to focus on nurses going back to school, but they wanted certification, they wanted to focus on simulation, they wanted to focus on faculty professional development. Well, if you have become all of these things, we need to reclassify the name. Oh, next slide. So we are in this self-inquiry phase, trying to figure out for the existing programs and also the new programs, what strategies we want to use to optimize outcomes. So we know that this is kind of like, it's in this, it's almost in the formative years, and even with EVP, it's going to bring that into a formative stage where we can really think about what to do and really push it forward. Next slide. The next is related to recruitment and retention. This one has just grown so much over the past 4 years. The first initiative is to develop plans to address priority areas based on the state workforce research and national best practices. So we pivoted our objectives. We initially had prioritized APRN transition in practice and community-based healthcare management teams. And while that is still important, COVID made other things more important. So faculty, LPN, specialty nursing areas, and then nursing well-being have all gone to the top. And so that doesn't mean that community-based healthcare management teams and APRN transition practice were dropped. But when you have a greater priority, you address the greater priority. And so we are working on those items now. And then we also launched the Preceptor Credit Assurance Committee. While that is not APRN transition practice, it does support APRN education and the APRN workforce. With clinical placement, we wanted to optimize clinical placements in our state. Bree's done tremendous work. During COVID, we lost for a period of time almost all of our clinical placements in our state. And she worked to establish standardization of new rules as much as possible and has been able to work with our community partners to bring back so many of those nurses. We're also talking about expanding that to Maui, and we're currently in conversations with the Workforce Development Council proposing an option to expand into allied health as well, because our clinical partners have said, well, it takes 6 minutes to process a cohort in nursing and 20 hours to process 4 people outside of CCPS. I don't have 20 hours to get, so can we please use this product for allied health? So we are currently working on that. We're also continually trying to expand this for APRN training. We're using it in the hospital, but not really in those community settings yet. And then our nurse residency program, we got 2 grants in 2021. One from the Workforce Development Council and one from the Department of Health, Alcohol and Drug Addiction Division. And those have really helped our partners utilize the nurse residency programs for new graduates. And I was looking at the numbers yesterday. I think we have over 500 new graduates who have been hired into acute care settings that are our partners. We know that there's a couple more out there just in the last 2 years. And so it's incredible. We really have seen a commitment by our employers to hiring our new graduates and then supporting them in their first year. Next slide. So this one is so large that we really need to we need to manage our priorities to yield outcomes. In some ways, I feel like we can't be everything to everyone with this mandate. And right now we are being asked to be everything to everyone. So we either need to bring on more staff to support these programs so we can scale. We can't keep on putting more work onto the same team. Or we need to tease out the work and only do certain things, but we can't be everything for everyone. And we need to pick, as I mentioned earlier, we need to pick what is data informed so that we yield maximum output or output. Next slide. So, thank you. Engaging in communication and public awareness strategies to support a strong nursing workforce and mentor initiatives. This is not a mandate. This is the goal that we identified in 2018. We wanted to expand partnerships. Certainly we've done that, and I described some of those partnerships. Diversify funding. We were able to secure increased revenues through nurse license fees through Act 66 of Session Law 2022. And we also have secured other funds for other things. So nurse faculty salary and professional development was put into the governor's budget and passed into law for this upcoming budget. And we have we've received awards for nurse residencies. Before the COVID pandemic, we also had funding for evidence-based practice. And those activities were able to be implemented during the pandemic. So even though they were secured prior to, they were launched in these past 2 years. Advocating for sound nursing and health policy development using data-driven strategies. I mean, the work that we're doing today is like the superhero of the work we were doing in 2018. Like we have really grown we have really heard that call to action, and I think the work that the staff is doing is so excellent and so responsive. And then engaging with national initiatives, certainly that's maintained. I also want to highlight that in addition to engaging with national initiatives, Carrie is a very active member of our national forum of nursing workforce centers and has done tremendous work publishing nursing workforce surveys for the nation, as well as helping guide that space. And Catherine is very active in the national space with evidence-based practice and is coming up with ideas here that are then being adopted. So I just want to highlight that part. Next slide. So we want to maintain course. I think we're doing good. I don't think we need to focus too much on this because all of the other mandates are driving it, and we're able to achieve it kind of as a secondary outcome of the primary work that we are set off to do. Next slide. Okay, so my key thoughts are that we have really improved accessible research with on-demand analysis. Nursing professional development efforts are important, but engagement can be strained. And I'm glad this is not a dig, because if you have no staff, and like Arthur Songhaga, I think is a great example, will miss meetings because he has to be the transport for patients at his facility. Okay, well, you can't pull off the high level strategy when you have to literally be moving patients because you don't have the one to do it. So we have to be really sensitive on how we pick our projects and initiatives to be realistic for the bandwidth that our partners have and also gain momentum. And then our recruitment and retention needs are growing considerably. Wellness, clinical placements, residency and transition practice support faculty, and the evidence to support policy and program development, all of that is a number one priority, but that's not how the word number one works. So, I mean, I hope that you all can help guide us, because like these are each of the things that we need to do, but we can't treat each of them as number one. We need to pick what to work on first or what to work on first. Having 6 priorities negates the word priority, but we have to be strategic, as Gab said. Next slide. So we have comments. We have like 3 minutes. If you have any comments, thoughts, questions, please. We have a tiny bit of time, and I want to hear from you. But that is how I'm seeing the center, and I just want to thank you all for the incredible work that you do.
Well, I just think us here and the advisory board members online want to recommit to helping in a new era. So the ask is really setting a nimble set of priorities. That we have a lot of background that we can all try to support something from our own way. So, I mean, I know I want to spend my time with something that needs something. You guys do something that changes. So I think we're just commit ourselves to being tolerant of a little bit of the unknown, so that we can try to dive at opportunities that seem to come up. And please, you know all of us and all of our little permutations that ask us. I mean, if you think of anything, it's probably thought bringing up. It's probably what we need here. So let's, be brave or think of crazier ideas and ways to support them.
Anne,
Yeah.
I just wanted to let you know you're still recording and your mic's still on, just in case you didn't know that. Thanks.
I think we are supposed to record the entire meeting from start to finish, and it will be a public record. Says the beautiful sunshine.
Hi, this is Rose. I love this pause because we have to be a little bit differently for the future and we can't do everything to prioritizing. One thing that keeps on coming to mind is we live in the context now and we have a different population of services too, with generational differences. And we see that more and more in my environment. So I'm also wondering about opportunity for us to really include the voices of the millennials more. And even beyond millennials, even the Gen Z, like they are already in emergency workforce. So when I look at this table, I don't know if we have that representation and how do we bring that voice forward? You know, what does that look like? So I just want us to consider that. Please feel free to stretch your arm.
I think we can keep talking, yes. Yeah, keep talking. I'd just like to thank those for bringing the issue of the younger generations of nurses that we are all working on, because that's something that YANA is really conscious of, is trying to bring the professional issues forward from those generations and to those generations within the population of nurses in Hawaii. And my dream is to pass, to get to retire and this position, pass it on to those services. So that they could run with it. And we're making progress. They have a rating and person program. And it's not great. Yeah.
There, sorry. So all hurricanes, and I have my. So I'm gonna get at least 40 minutes of food. Thanks.
Laura, if you want to just let me know when you guys are ready and back from your break. Are you guys ready to get started? I want to make sure you guys had enough break and time to stretch and get stuff to drink and eat and all of that.
Thank you so much. So Sherry, this is Laura. I'm gonna introduce you really quickly and then we'll mute so that you have the floor. So I would like to welcome our guest speaker, Dr. Sherry Daniels. Sherry Daniels is the Chief Executive Officer of Papa Ola Lokaki, an organization charged by the United States Congress with administrative oversight of the Native Hawaiian Healthcare Improvement Act, Public Law 102-396. In this role, she leads efforts to improve the overall health and well-being of Native Hawaiians and their families through strategic partnerships, programs, and public policy. I'm so excited for Sherry's talk because I feel like we have a lot of similarities in terms of how we're set up. And also with our great need to innovate, we have so, I mean, it's just such a gift that she's sharing her time with us. So thank you so much, Sherry. I'm very excited for the next hour and a half that we're going to spend with you.
Thanks, Laura. Hi, everyone. I know it's a Saturday. I see some people on Zoom. And I see a bunch of you at Vai, and I wish I could be there with you folks. I love being at Vai. So thank you for inviting me, Laura, and the other board members. Today, we're going to be talking really about business strategies. And it's really to help you folks look at these health initiatives and how you move forward. And I was really glad to join in during Laura's conversation with you folks, because there is definitely a lot of overlap. And a lot of it is really, and I think Laura mentioned this, how do we not be everything to everyone and really be strategic in what you folks focus on and put effort in? And I think it's not only about being strategic, it's about being intentional. And that's a really hard thing to do, because I will talk about it towards the end of the slide, but you have a lot of things you could be working on and should be working on. So how do you prioritize what those look like? And if I can get my slides to go there. I wanted to just kind of start off with, and thank you, Laura, for the really great introduction. My role at Papa Ola Lokahi, and people think that all we do is Native Hawaiian health. That is the majority, that is our target. However, we recognize that we live in communities that are more than just Native Hawaiians. We live with a range of other folks within our families, within our community. And that's similar to what you guys are focused on. Yes, it's nursing. Yes, that's your primary focus, that's your target, but your nurses are embedded. They live in communities that are made up of a lot of different sectors, a lot of different types of people. Your nurses work in varying spaces. And so it's not just so siloed, because the work you guys are doing impacts other pieces and has a ripple effect that affects communities at large, not only in your community, on those islands, in the state, but nationally and internationally. So I think that's really important, as Laura mentioned, that we have some similarities in the works that we do. I think one of the things I'm going to put out here, and we can talk about it throughout the conversation today, is about change. I think change is perpetual. I don't think we wake up in the morning and go, yes, we're gonna be talking and doing change. Change just happens. Change is part of our everyday breathing, moving around. Change is always happening. It's perpetual. The difference is how we manage change and how we look at change as opportunities. And so I think that's the theme for today, is really about change and how you folks can put on the hat of change agents as we move through what you guys want to accomplish. I do want to talk about really the background from what I understand it to be, and this is a layman's kind of assessment. But you guys had real clear timelines. You guys were established. You guys were funded through the nurse license fees, and you developed a strategic plan, which is set to kind of end next year in 2023. And so this is kind of the time and space to start looking at what is our next strategic plan. What have we accomplished? When we look at your gains and successes, and quite a bit, right? Like you guys were able to increase your license fees, which has allowed you to have more funding to be able to do more things. You guys have really increased and had shared dialogue to be able to understand what it is that your boots on the ground nurses are needing. So really looking and understanding staffing models. But also looking to practice safety as well as cultural patient care. Now, when I say success and gains, this is really in your space. That doesn't equate to gains and successes in the bigger world you live in. And I'm going to say bigger world because many of your partners, your members work in spaces maybe that are not as conducive to the quality of care that you guys expect or would anticipate for your nursing workforce. We also have some recognized needs that you guys came up with, and that's really how to develop a model of engagement. And again, when we talk about engagement, I'm talking about not just within your nursing group, but how do you then translate that between workforce and management? And what I had shared with Laura and Anne a couple of days ago or last week was that oftentimes you guys can control the narrative in your space. The challenge becomes, how do you not only translate it, but operationalize that translation to spaces that you have zero control in? And if you think about it, hospitals, institutions, even small practices, right? They're running based on their need. And you guys don't control what those needs and those actions turn out to be. And that's often where the disconnect comes, right? When you look at entities that you have really great relationships with, that your nurses feel heard, they're thriving. When you look at those models, what stands out? And it's often how it's the engagement between your nurses, you folks, but also the management team. And oftentimes there's an underlayment of trust and communication. Now, trust and communication leads one to believe that it all is, sunshine, gumdrops, and unicorns. And unfortunately, it's not. The successful models of engagement often include very hard conversations, a lot of back and forth, a lot of jockeying oftentimes, but what it leads to is an increased trust and increased communication, because what you've created is this sense of, we have to constantly understand what's happening. We need to be in those spaces to have hard conversations with leadership and to be present. I think oftentimes that is met with, you guys are kind of unruly, kind of rogue, challenge to work with. And that's okay. But what you're doing is you're advocating. You guys are seeing as advocating. Oftentimes the other side sees it as just being difficult. But constant being at the table helps to develop your model of engagement. And so I think that's a recognized need that you guys are looking at, especially as you are starting to discuss what your next strategic space is going to look like. So currently, there's the perceived needs, and I categorize it as perceived and identifiable. Perceived is what you guys hear out there. How you guys got that perceived needs could come from a range of sources. It could come directly up from your workforce, that this is what you're hearing from the boots on the ground. It could be through a survey you folks conducted. It could be through conversations with management that you guys have had. Those are all perceived needs. And the identifiable needs is those that like this is something we recognize, we've heard it, we have data on it. This is what we know we need to work on in order to move forward. So in terms of perceived needs, we're looking at, or you folks are looking at the review, redesigning of a strategic plan. What I had shared with Laura folks is that what we're seeing due to COVID is many organizations are now looking not so much at long strategic plans. Kind of gone are the days of 4, 5, 10, 15 plus years of a strategic plan. And organizations are really looking at short year to 2 years, 1 to 2 really strong initiatives to move forward. Because what we're finding is like I think Laura said it, everything to everyone, how do we scale appropriately? Well, what we're finding is, especially during COVID, right? Everything kind of got thrown up in the air, and what fell down is often, it's all over the place. It's not in a nice kind of contained space. It's all over. And so what organizations are doing is saying, what, we really just need smaller bites to chew on. Because if we start trying to do 10 things, it becomes unmanageable, it becomes diluted, and the intentionality of what we want to achieve kind of doesn't happen. And so there is this movement for smaller, tighter, more concise initiatives and plans, if you even want to call it a plan. To me, strategic plans gives the impression that there's no flexibility. Versus if you're looking at kind of a strategic vision, strategic, initiatives, things that can be more flexible in nature, because anything we've learned over the last few years is the need for flexibility and being nimble. And I think as an organization, the center really needs to be nimble around what they're working on. Some of the identifiable needs you guys talked about, and I also heard, was research, using evidence-based practices. Now, research is a very large, massive thing that a lot of times organizations can't really get their arms around, because when you think of research, research can be a multitude of things. So we can look at research from a national perspective, which I know you guys do, from a state perspective, but also from a county perspective, not only from county, but how do you even make it more granular to communities? So now you're not only looking at, say, Oahu, but you're looking at Oahu and windward side, between, Waimanalo and Kahuku. And so you can even get even more granular than that, because maybe you want to look at community, windward Oahu, but I want to look at generational impacts. Somebody had talked about that generational need, right? The millennials versus the Gen X's versus we still have, workforce that have been in the field for 40, maybe even 45, 50 years. That's a very different generation of working mindset, but also the change. So research can be very broad and very narrow. So how do you guys select and pick what really will have impact and make, in mindful change, effective change, right? So it's also picking your projects more strategically. I think another identifiable need is the development of task work groups. And if you saw, I intentionally put tasks/work groups, because a task group is those that are often tasked with kind of the thinking. They're the think tank folks, the ones who are imagining what a plan or what projects could look like. They're the thinkers. The work group is very different. They're the workers. They're the ones who are pushing those policy agendas and those thoughts from boots on the ground to actually completion. They're carrying oftentimes those heavy loads. The reason I intentionally put task/work groups is, if you create a task group, you shouldn't create it with the intention or the idea that they're going to come out with a final product, because oftentimes they just get stuck in the thinking part of it, and the execution or pulling all the pieces together to actually execute really is not their strong suit. And so it goes back, when you're developing groups, same as when you're developing your plan, is finding fit. We often, and I heard this from Laura, we often are calling on the same people, right, to sit in these spaces, to help move things forward. And that's great. But what happens is you burn them out. And so how do you start bringing in new faces to the table to help move things along? But it's also figuring out where people's fits are. Because if you have somebody who's really a work person, who's like, just nose to the grindstone and wants to get things done, they really struggle in task groups. They're good to bring them on towards the end, when you're ready to kind of transition or transfer the project and what you guys are hoping to get out of it. So I think that's really important, is to be really thoughtful in the fit of people that sit at the spaces at the table, and how you set up your table. Because I always look at it, the task groups, they are putting together the cake and getting it ready so that the work group can really decorate it. But how do we transfer from task to work without the cake falling, right? So it's those kinds of really those times and those spaces that for Laura would need to really make sure, okay, what are the resources to help make sure we don't drop the cake before we can get it decorated? So that's just something to think about. And then the other thing that was identifiable was the stabilization of your workforce. One of the things I learned in talking with Laura and Ann folks is that 50% of your workforce leave their jobs within 2 years. That's a very powerful statement. That ties into your recruitment and retention practices, which I think in Laura's kind of state of the center, she also talked about was, how do we keep and retain and recruit? And they play hand in hand. Now, if you guys are kind of following me, the part that we don't know is the placement parts, right? Those that are the institutions, the health centers, the hospitals. We don't know what their perception of stabilization of workforce means. We also don't know what that picture looks like, and how do you communicate that not only to the employers, but also to the community at large, right? I think the community understands we have a nursing shortage. I believe the community understands the challenges of the profession, right? That's been communicated very well over the years. But I think to have that understanding that, wow, 50% leave the job. Why? How come? I think that's a very different type of communication strategy to the community, but also to the employers, because employers are I think I called them, Laura, bean counters. They really are. All they're looking at is the cost, right? They're moving the beams around. But as I shared with Laura folks, if you're using the 50% leave jobs as really the communication thread or strategy with employers to use their bean counting as an engagement tool, that we understand this is kind of what we're seeing. So for you, employer X, that means it's a loss of this much dollars. So it's a cost analysis that you could do, because that cost analysis can help them recognize like, well, you don't want to lose X amount of thousands of dollars after 2 years because you've invested in that employee. Well, how do we help you change the organizational culture so that you're not losing that monies, that those beans stay in your bowl? And I think those are the types of strategies to kind of pivot around, because you unfortunately have to take the approach of pivoting to fit the employers from their perspective. And that's a hard thing to do, because you're like, wait, Sherry, we got our own perspectives we got to deal with. Now you're telling us we got to shift and kind of come from their angle. Yes, you do. Because if you want to have success for your folks in the spaces that they have to work, live, all of that, then you're going to have to put on a different set of glasses to see from their perspective, so you can share the narrative from their understanding, their level of understanding. Doesn't mean you're going to go and, lock arms and sing kumbaya through the fields. That's not what we're saying, or what I'm saying. I'm saying you're then recognizing that they're seeing it from a very different perspective than you are. And in order for you to see success for your workforce, you're going to need to put on a different set of glasses or move a little bit to see from their angle and speak in their terms. And that can help navigate the communication and build the trust. So as we look forward, let me pause. Does anyone have any thoughts, questions? Am I totally off track here? Or are there spaces that you kind of want to dive a little deeper into?
There we go.
Affirmative, yes.
No, let's see. Oh, there we go.
More about all right, this might be loud. Thank you. That's good. I wondered if you could go a little bit more into stabilize the workforce and what that picture would be. Thank you.
So stabilizing the workforce, is that what I understand the question to be? Talk a little bit about that.
Yes.
Yes.
Okay. Just making sure. Okay, so when we look at stabilization of workforce, one of the challenges when we're in, so I'm going to make the assumption that you guys are all in the middle of the eye of the storm. It's like, well, let's use Ian, for example, right? We see the pictures from the International Space Center of this massive cloud, right? This huge weather system called Ian, the hurricane. But right in the middle, we just see space. And I'm thinking that that's where you folks are at, right in there. All around you is the storm that's brewing, the storm that's churning. And when you step into the storm, you're almost holding your hat, holding your umbrella, trying to kind of see where all the pieces are. And it's, if you guys have ever been in the rainstorm, right? Sometimes you can't even open your eyes, or you're looking and you're trying to do 5 things and trying to accomplish one. And so I really think that when we talk about stabilization of workforce, we often think it's the nurses in the workforce, and it's not. The stabilization comes from, and I'm going to say it's a multi-prong approach. And so it's almost like Laura's the one with the big, what is that? Horn thing, yelling to people where to go. And what happens is Laura is the one deploying folks around. Laura's the one that's trying to track where everybody is at and the task that each person is accomplishing. So that's when I mean the multi-prong approach is Laura has to stay in the middle where it's calmer because she can see, she's kind of the drone, and she can see where everybody's movements are. Now, Anne might be her area or her part of the storm is faculty because she's teaching, she's, faculty and what that faculty recruitment might look at. And that's a part of stabilization of workforce. You might have somebody else, and I'm going to just randomly pick a name that I saw here, Roberta, right? Roberta might be looking at, the current nurses and trying to figure out what are the needs in those areas and how do you going to stabilize that pocket of folks in the storm. And then we might have somebody else, I'm going to use, is that Clementina? Clementina, is that
You can
right?
call me Clem, Sherry, for short.
So Clem might be working on the incoming workforce. Maybe her focus is on students when we talk about, and Clem is going to need to not only look at the incoming workforce and how do we develop those skills, how do we give them good faculty, so working with Anne, right, to make sure that bridge is there. But also Clem's looking at placement, which could be somebody else's Kuleana in task. So even though when we talk about stabilization, it's not just one. Stabilization is how do we create a platform or a foundation that's gonna have multiple strands and areas, but those areas also touch into other spaces, right? We know that the faculty group, when we're looking at stabilization components, it's not just the faculty that's teaching and all the best practice models, all those core competency pieces that they're going to need to have, but then how do they also communicate to Clem? And this is the kind of future nurse that we're looking for. This is what we see as when they come in, they're better prepared. This is going to lay the foundation for success if they have these kinds of pieces coming with them. We have Roberta looking at those nurses already in place, and she's talking to Anne about, okay, how do we develop a ongoing learning for our already seasoned nurses, right? So it's everybody has to know their place in the stabilization, but they also have to be able to reach across to each other to be like, you have an expertise, Clem, help me develop here, let's work together. So internally, there's stabilization, right? So and then Laura becomes the ringmaster of sorts, because she is the face of the center. Yes, you guys are feeding up to her, so she knows that she can then bridge across with the employers, with the bean counters, with those entities that are going to be housing your folks, right? Because what you want to hear is when they're there in their workspaces, that they're able to communicate like, yes, Roberta, when I was in school and I learned this, thanks to Clem, I understood what I needed to come in prepared with so that Anne folks in the faculty side could fill my toolkit better. So when I came here at this institution or in this entity, at this hospital, I was able to kind of tie those pieces together. And I was also able to recognize what it is that I need in my place of employment to actually do, you know, the safety and cultural practices that we want to see for our patients, right? And then you're going to have somebody, Laura, leading the charge in talking with those employers, with those bean counters, because then she can, you know, reiterate what all your nurses are going to be gaining and what they need to be successful, not only them, but really, right, translating it to them that, and this is how your hospital, your organization, your entity is going to gain because you're able to get this much on the investment on that one nurse. And we know this because Laura can go back and follow the bread trail back to that nurse. And so when we talk about stabilization, this is where your stabilization of workforce is like research. It's huge. And I'm sure you guys are thinking like, holy smokes, there's how many of us in the meeting today? A dozen? Are we? And I'm saying, and I'm kind of giving permission, you guys all can't do it by yourselves. This is where you have a huge group of nurses. You guys have colleagues all around the country. So I think this is where really picking your top 3, which is going to be hard because just here on these needs, stabilization, research, those are 2 big buckets. And for me to tell you guys pick 1 or 2 total, you guys might say, well, we could do 1 or 2 from each. So with stabilization of workforce, it's really possibly looking, and this might be part of your research, is looking at what is the environment, what's the environmental scan of our workforce currently. And when I say workforce, I just don't mean those that are in like hospitals or institutions, right? What does the workforce look like across in terms of students, new nurses, the fact, all of that, and really then seeing what the picture looks like, because you can't really move until you get a clear snapshot of what your storm looks like under the clouds. And you guys might know that, and you might know it for only one section, but in order to really make shifts in paradigm and in thinking, you're going to need to look at the whole package, even if it's a space that you guys really haven't dabbled in. Does that make sense? And did I answer the question? And I'm gonna make this wild assumption that you guys all know this. And so I might just be reaffirming for you folks. And the unfortunate reality is, no, I don't have a silver bullet that you guys can take and shoot into the clouds and clear the storm and be able to just get your work done. Because if I had that, I would use it for myself. But I think you guys all know this. It's just like, oh gosh, how do we then roll up our sleeves and get to work? And that's the hard piece. Thanks for the question. And I'll stop to make sure. And please, raise your hand, tell me to stop, and I'll stop. Okay. Okay, so as we move forward, or we think forward thinking, there's really 2 sections that I highlight, and those are opportunities that you have and obstacles that you know, or even obstacles that you don't know, right? And that's part of the environmental scan. That environmental scan should help identify even opportunities that you didn't even realize were there, that you haven't tapped into yet. That's a good thing in doing an environmental scan. The many organizations, and I can say this because we had gone through this ourselves, is many organizations find it really difficult to hear not good things about themselves. However, you want the honest junk, good, bad, great, fabulous. You want the gamut, because when you're not really honest about what you're doing well or what you're not doing well, then you're going to be circling the wagon, and you're not going to be making change, sustainable change, right? I think it's like when we assess ourselves, we always kind of downgrade how great we are because we don't want to look like we're just so arrogant. And yet we also don't want to say how horrible we think something is, or somebody else's something is, because we don't want to be rude and call that out. But we need to, both ends of the extremes, because that allows you to find where your baselines are. And that also gives you a very honest idea of where your outliers are, right? So if you have some real extreme outliers, they could be one, something that's beyond your control. It could be an institutional issue, right? That you have no control in, but you recognize it's there. And that could be something that might not be something you go after and start fixing. That might be stuff that you're fixing a little further in, that will have some rippling out to them to kind of move the dial to bring them kind of more inward. But that's why you want to know where your outliers are. And so I think one of the big opportunities is a convening. And this is the task work groups. This is bringing together, and however you strategize this or create this is your guys' decision. And I know this will sound like a lot of task groups, but just bear with me. You identify all the pockets, the nurses, the direct line. You can do nurses by communities, by islands, right? So nurses may have 3, 4, 5 different subgroups. And then you have faculty. You have leadership, meaning, and I'm talking leadership or management from hospitals, institutions, those folks. And I'm going to say Laura and who else, are convening those groups, those task groups, because they're going to have very specific needs and issues that they're going to need to flesh out. And then what happens is they identify 1, maybe 2 at the most representatives to come to a larger convening. Then you start bringing everybody together. And then you start having them talk about those challenges in each of them. So what you're doing is you're creating space for venting, right? In the smaller spaces, the venting. This is all that doesn't work. We don't like it, da, 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 da. But we're also venting all the good stuff. And then the representative comes to the larger group to say, these are our strengths, these are our challenges, right? This is where we sit. This is our viewpoint. This is our perspective that we're coming from. And each brings those same pieces. Well, then what happens is they start having those conversations. And so say Clem is the reporter back on the direct line. She's going back and she's going to say, hey, this is what we're talking about. This is, what do you guys think? Right? So that there's that ongoing communication. You're not bogging these meetings down with, 100 people or 40 people. That makes it very unwieldy. But what you're doing is you're having all the thinking and all that stretching around in the smaller work groups or task groups. And then you're taking it to the one that bridges everybody together, right? And you could have 2 people so that if Clem isn't there, Laura can be, there's always a consistency of of those folks coming to the table. And what you're also doing, so Laura may say, okay, we're going to identify the must-haves. So this is what you guys are, right? And to kind of almost guide the conversations, or your facilitator will guide the conversations around, these are the must-haves, these are the non-negotiables that each of you guys are coming in with. That's what we want to talk about. And in the smaller group that has all the sections in the room, that's when you can talk about, this is the space that we're able to move in, negotiate in. Not that you're negotiating, maybe that's not the right word, but then you have a space to have better understanding. And then it's because you're going to need the weeds, which is going to be those specific areas, the nurses, the faculty. Then you're going to have to go a little high level on what you guys are moving on. Does that make sense to folks? And it seems like more, it does seem like, holy crap, that's a lot of meetings. It is. But what happens is, it's actually probably less meetings, because if we were to bring everybody to the table at once, I'm sure you guys all know what's going to happen. This 3-hour meeting is going to be spent, more than half of it, in people like verbal vomiting on the table, because they have now an audience outside of their own space to be like, I just need to get this out. And you guys have whatever, right? I have 20 years of just angst that I need to drop on the table right now. And then that doesn't become productive. And then you're actually going to have 2 or 3 more meetings, because everybody does that. That's just what happens. People need to regurgitate stuff and throw it on the table. Those can be done in the smaller convening, so that when you get to the kind of all the multiple groups, everybody has already had that space to vent. And then now it's about working. So that's why I recommend that. And that's why it does seem like a little longer. The other thing is the bridging. So an opportunity that, that I've seen, or that I've also heard, is the bridging, emphasizing the storytelling lens. And that's, I think you guys are really good at that, because that's how community knows, nursing shortage, hardworking profession. You guys have, developed a lot of storytelling around who and what a nurse is. The assumption is that the bean counters, or those employers, understand the story you're telling. But that's not the story that they're telling and that they need to tell, or that they work under. So how do you bridge your storytelling with what you need to have accomplished in these different spaces? And I say, the bean counters, but it could be legislators, it could be, government agencies. Their storytelling, what they're hearing, maybe not what community is hearing, or what your nursing group is telling, right? So it's kind of the game of, what is that whisper game, right? When I tell Laura the sky is blue, by the time she gets to Anne or to Roberta, it's the sky's purple with a mixture of pink frosting, right? The story has changed, because how we see the story and what we hear of the story, we all take pieces of it. And so, that could also be an opportunity, is how do you bridge what you guys have been successful at and what you need to accomplish with those that need to help you get there, right? That has control on things you have no control over. When we look at obstacles, it's often the lack of alignment. And it's not a bad thing. It's just, you need to recognize where people's alignment and organizations and agencies' alignments are to you, or what you're choosing to focus on may not be what their choice is. And so oftentimes the lack of alignment is an obstacle. Now, it doesn't mean that you have to realign that you have to change your goals. And it absolutely doesn't mean you have to change theirs, because you will be working your darndest with probably no change or zero results, which is time wasted. So it's finding out where these alignments are or aren't, and whether or not you can bridge those alignments, if you can create, crosswalks on those alignments, or if it's something you're just going to have to say, we can't. It's too far off alignment for us. Maybe we got to come back to it when we get these other pieces in place. Right. So again, it's making very intentional movements based on what you know is happening around you. And then the other obstacle is leadership, right? And I talked about that very briefly, that oftentimes relationships are developed based on trust and communication. And oftentimes the different partners or different leadership partners have other areas that really aren't in cohesion with yours. So same with alignment. Sometimes you're going to have to say, okay, we're going to have to pause on that one. Now the group may say, no, we really gotta push that button. We really gotta push and make movement. And if that's the case, and if that's the group's consensus, then you're going to have to decide, what do you mean by moving the dial, or moving, creating that? Because they may be wanting to move the dial like all the way, or are you willing to just take like that much, right? So having those internal conversations on what is it that you're willing to live with and compromise on. Because again, as I mentioned, uncontrollable factors, right? And when to walk away, because some things are better left to not touch and let it just, it's like letting dough sit, right? You don't need to manipulate it, just let it sit, because it's going to, the yeast is going to do what it's got to do. And then you can come back to it when you're able to roll it out, to work on it in a more easier fashion. And some may have to sit for a while. But Laura's role is to just kind of keep an eye on it, right? Okay, it's ready. Let's go. We're going to send a team over, because now we've waited 6 months and we're ready to pull the trigger on something, or it may take years. But I think it's recognizing those spaces. Okay. I'm looking at Laura like, okay, nodding her head.
Question?
Oh, there's a question.
Sorry, Laura, were you gonna say something?
I don't know, I'm gonna.
Okay. Hi, Carrie. This is Carrie, the researcher in the Center for Nursing, and I have a question. I think they can hear better. Roberta, can you guys hear me? Yes, that's a yes from Roberta. Okay, so the question I have about sort of like this business of alignment and storytelling, I'm trying to apply that to a specific case. So I'm thinking about conversations around the nurse license compact in particular. So one of the challenges that I feel like we have, part of my job is to not just provide data, but discussion, comment, and kind of context around the data. So we have situations where we have a problem in the state of Hawaii where it takes a really long time for a person to get a nurse license. So there's a lot of conversation about maybe if we join the nurse license compact, we can avoid that problem. So there's a kind of growing interest in that. And at the same time, the Center for Nursing has concerns about that perspective. And as a solution to dealing with the nurse licensing delays, we also work with the Board of Nursing, or the Professional Vocational Licensing Division, who has its own set of concerns around implementation. So what recommendations do you have for how the Center for Nursing, who is sort of in between all of these entities, and we have to have perspective for all of these entities, we have to talk about the problem in a way that is meaningful to them, while simultaneously also talking about what we know to be true. Our data say this, that, or the other, and it may not be in alignment with what other people think is the right thing to do from their vantage point. So how do we bridge across perspectives in that way, when we kind of have the most neutral perspective maybe sometimes, and people are resistant to that? Am I making
Okay, so yes, you are. Total sense. So I think you know, you guys are coming from a space of neutrality, correct? Right?
We try to be in most cases, yes.
Well, I think when I mean you're coming from a space of being neutral is there's no gain. You guys are not coming from gain.
Right.
Right. There is no there's nothing like that you guys are going to get from this.
Correct.
You guys, right. So you guys are kind of that neutral spot. And all you can do is have conversations with the folks, you know, the ones who have concerns and say, hey, this is what story we want to put out there. Okay, so infographics are always wonderful. But I think it's the did you know? Yes, did you know this is the delays? Did you know? Now the state office, the ones that have also the concerns, they might be like, oh no, that's too right. So you may have to put out information to your groups, really to the broader community, because those that are already nurses, it might be great information for them to know because they might have, you know, folks that they know, work with, those kinds of stuff. So I think it's great to give the information to them. I don't think it's bad to use your data to be informative. And really the did you know kind of piece is kind of allows you to stay neutral and you're not putting in your own assumptions, right? What I heard you say, it's coming from data.
Mhm.
And you're going to say from the whatever source you got it from, here you go. These are things, because there might be things that people don't know or aren't aware of in terms of the process and maybe the backlog of things and why. And so even to storytelling can also be webinars, you know, like informational webinars that, you know, you guys can bring, and you guys can bring people together. So a lot of times too, it's in Laura's role, is she able to bring those other entities together to say, hey, you guys, what are some of the challenges you have? Yes, this may look like the grass is greener on the other side. So it's almost like when we have gubernatorial debates, it's not a debate, it's an informational sharing. So people can make a choice. That's what it's going to come down to, is people are going to choose to hear what you're suggesting or not. And your role is to put out information that's accurate so people have a choice. So that's really what we do at my organization. It's really hard, right? Because a lot of times people are listening to friends, they're listening to social media, and they often get 2/3 of the accurate story. And so you folks have to be the ones to say, okay, people need to be informed. This is the correct information. Yes, it might not be what we want to hear. Yes, it might, you know, add to more challenges or more, but this is what the information is. And to just come across as this is factual. We're here to make sure you're informed so that you can make a decision that matters to you. That's so, you know, that's a choice that you're going to make. I think that's where you're going to have to come from. And that's sometimes really hard because you want to, right? It's like, yeah, why don't you know this? Or if you guys only knew there's all this other stuff, and then you're kind of explaining, and it's like, maybe if you brought folks together to say, hey, we want people to make informed decisions on what's happening regarding this issue. So let's put out some infographics, maybe do a webinar. And if they choose to not, to at least say, okay, if you guys don't want to choose to participate, that's okay, but this is what we're going to be saying about this. And this is what we understand to be fact. And so do you agree or not? And then you put out that information.
Thank you.
Yeah. Okay, the other thing I need to just add to that is sometimes we think we have to be in the popular consensus crowd. And unfortunately, the reality of life is you often are not. And that's okay, because you're in the consistent crowd, the consistency, the factual, neutral, consistent crowd. And that actually, to be able to sustain that type of engagement, that type of kind of information sharing, storytelling is a lot harder than flopping over to what's popular and what's easy to do. So just keep that in mind. I know that's not helpful, but it helps me stay focused, because sometimes I'm just like, I want to do what's easy. I want to do what's cool and popular. But that's not always the right thing to do. And so often the right thing is a little harder, takes more time, takes more effort. And you'll see the easy ones get all this traction and all this movement. And you're like, oh, just stay the course. Just stay the course. That the tortoise story, the hare and the tortoise always, it's just time. So I hope that answered your question.
Good, thank you.
Yeah. Okay. So, one of the things that I have, okay, I'm sorry, I'm going to go back here, but you guys see this, these two circles. The reason I put these two circles is there's the center, all the things that you guys have to do. And then there's all the external stuff, right? So we'll use that nurse license compact. There's all this external stuff. The thing that matters is right here in the middle. That's what you're trying to achieve, because everything else is white noise. What you're trying to do is get to the middle section, this one right here. So, a colleague once told me that for them, this is like, yeah, the sweet spot, it's all that, but if you, cinnamon rolls, so they kind of, compare this to a cinnamon roll. Most people like the gooey middle. That's what it is. This center is the gooey middle. A lot of people don't like the crusty ends. People don't like all the super frosted on the top. They like all the sweet cinnamon in the middle. That's where if you can achieve that, that's success, because you've been able to bridge, right, these two worlds. Sometimes there's even a third circle and sometimes even a fourth circle, and the sweet spots shrinks because you have more stuff, right? More hands in the game. So, but I just kind of went with two. So just to have a visual, so you guys can kind of think how that would look like. Okay, so when we look at next steps, so again, right, when I talk about shifting of paradigm, oftentimes people talk about the top to bottom concept, right? Meaning the top is all the policymakers, the leadership from these entities or organizations, and the bottom is your workforce, your nurses, your faculty, however the hierarchy is. One of the suggestions that I have is some people will say flip it, right? Flip it, and it should be the bottom, the workforce should be pushing down, and the leadership or those externals pushing up so that they can come into the middle. And what I say is, no, you want to flip it on the side. So now you're looking as a linear, right? When it's linear, then people are not pushing up, right? And feeling like, oh my gosh, I'm having to give up so much by pushing upwards. And then the ones pushing down are like, oh yeah, of course, right? There's no investment going down. But when you put everybody on a linear path, then they have to walk pretty similar distances. And then you can see better where people are going to fall. And then you can cluster them along the linear path. Now, if we say our ultimate goal is the middle ground where we have our nurses, we have our faculty, we have all the things, and then we're able to look linear where we put them. So that's just a different thinking of how you might do alignments, just some thought. So when we look at next steps, I kind of broke it down into two sections. Imagined, so these are like really your wants, what you hope and dream for, right? What you'd like to see happen in the next X amount of years. And then we have actionable. These are you need them. This is our non-negotiables. And so when we look at imagined, one recommendation or next step could be, what does your financial modeling look like? When I say that, I mean, what's the cost analysis for the strategies that you want to invest in pertaining to workforce? And that's just a fancy dancy way of saying, show me, don't tell me. So the data you collect, the stories you hear, how is that equate or translate into cost savings for the bean counters or for the hospital management, right? If cost is a big constant in conversations, we can't because it costs too much, we can't because it's a high cost workforce, we can't, then you need to then be able to counter that with a cost analysis. And I briefly talked about that with the 50% leaving in 2 years. If you're able to show the cost of loss and how that cost of loss impacts the cost to the institution or the hospital in terms of lost revenue. But if we invest this and we create this space, this could be the revenue gain that you'll have. So that's what I'm talking about when I say financial modeling, that everything has a cost tied to it. Everything, even time, even, right? So even a nurse, when we talk about intergenerational nurses, you're going to have different cost modeling for the millennials, to the Gen Zs, to those that may have been in nursing for 30, 40, 50 years. There's going to be a different cost associated with that. And so is there modeling, financial modeling and visuals you can create around that, and to be able to understand and tell your story as well and connect stories and alignments. Looking at how you redesign engagement. And I talked about that with the top to bottom, vice versa approach to the linear view. And that is really a paradigm shift, right? Because no longer are we going, oh, well, we're working in this top bottom structure. We're saying, no, flip it on its side and everybody's on a linear. Because then you can better see everybody's looking ahead or being able to turn around, not hurting our necks looking up. And then the other thing is, how do you value your DEI strategy? So this is diversity, equity, and inclusion. I think I was at a meeting one time and somebody had flipped the E's and I, and it was diversity, inclusion, equity, and the person was like, the DIE model. And I was like, oh, I don't know if that's really, I don't know how I feel about that. So I've seen it multiple ways, but DEI strategies, diversity, equity, and inclusion. And I think that's also something organizationally. So the center really needs to champion their own DEI strategy. What does that mean for the center? Because then that might help your space of neutrality and being neutral, and what that means and what you value. So I think that's a real strong statement around your value around DEI strategies. Okay. And then when we look at the actionable, you're often led by the why, what, and how. And I think in hearing and having the conversation with Laura and her folks last week, you guys know what the why, what, and how is. It's how do we then execute those things? You guys are doing the research that will lead the work that you do. But remember, research is huge, like I mentioned, right? National, state, county, but you're also talking about even more granular around subsectors and areas. So research, you really have to be thoughtful in what you want to pull research on and data about. Because like anything, data can be skewed to the way you need to have it be skewed. And so right, I think that's also a very important conversation in your data group. What are we looking at data on and why? And how is that going to tell the story? The other thing is really being open to changing philosophies. And I heard this from Laura's talk today, not everything to everyone. But that's an organizational culture and philosophical, space that you guys hold. If that's where you guys are leaning towards, then that's what you need to communicate. And it's not that you're not engaging, that's not what it is. But what you're saying is we are going to be looking for quality versus quantity. That's very different. And that's going to be the same message that you're going to be sharing with your members because, right, they may have 10 things. Everyone may have 10 things, and that could equate to like hundreds of things. But then, as I mentioned, hundreds get very diluted. It's like drinking like super watered down Malolo syrup or Kool-Aid. Anybody had that? Like super watered down. And it's like, well, I must have just been drinking water to begin with. And yet you want to have a full flavored work. And that's what being very thoughtful and intentional in what you're choosing to do and how you communicate that. Because some people may get very frustrated that you're not doing everything. Now, most people want to push their stuff. So I may look at this and be like, geez, Laura, I just wanted this. That's not everything, it's just this. But I remember, I'm not looking that there's 100 other people in line or that has already come to Laura and asked to do this. So I'm really maybe 101 at this point. I don't know that. And so that's part of the storytelling, right? And setting your parameters. It's not that we don't want to, support and serve all these different ideas and initiatives and things that could really uplift, but we have to really be thoughtful and we may have to cluster things. So instead of 120 initiatives, we're really choosing 10. And this is why. And so to have those. The other thing is changing philosophy also includes on demand. And I had heard Laura say that today. And on demand, don't forget, also means you're not fitting into others' world or paradigm. You're aware of what their world and their paradigm may be, but that isn't yours. And so it goes back to alignment. And so on demand is quite exhausting because you're jumping, you're jumping and changing hats and running into all these spaces. And what you get is just a small gain. And so, right, it's like, if I had a bag of coins and I had 50 cents, would you prefer to have 50 pennies or 2 quarters? Probably 2 quarters. So, right, so the weight of what you carry when you're on demand is a lot versus, no, I'm going to really just work in quality versus quantity. And then the third actionable recommendation or step you could take is to return to the table. And so today is really kind of, I'm just putting out the conversation. Again, I'm assuming, and I think I'm pretty accurate, that you guys have already been thinking about a lot of these things and are more clued in and tuned in to what you need to do. But remember, the table isn't preset. The table is one that you can add a leaf, you can remove a leaf, you can add chairs, you can do all of those things. So returning to the table means that your table may look very different as you guys kind of move and shift around, and that's okay. And in fact, you might have people who bring supplies to expand the table. Maybe they're like, hey, we want to be able to see more people at the table. I'm kind of, squished in at the end here. And you may add pieces to make it a big T. So now everybody can see, right, each other. So returning to the table and really looking at intentional planning based on what you want to achieve and your ability to achieve it. Okay, now those may not necessarily be positive, because in your planning, you may recognize that, oh, I thought we could and we can't, right? And then you're gonna have to take a few steps back to fix it to be able to move forward, right? So never look at achievement as always like, we're gonna get it, it's gonna be fabulous. Some achievements means that we're gonna have 2 steps back happen to us. But then that's part of opportunities, right? That's part of the growth potential you guys are experiencing in and learning about. So not always bad. Any comments to kind of the next steps? Nope.
This is Laura. I am so appreciative of the comment and the discussion you've provided so far. I think what's reassuring to me is that we do have a lot of these task groups right now, and we're getting through to the point where we need to be developing a work, like identifying what that is. And so it's a really good time for us to thoughtfully think about how to present that work of these subgroups to the advisory board. And what struck me, what we normally have is we have our staff present the work to the board. And I really value your idea of having 1 or 2 spokespeople identify each of these subgroups to represent that work, and then let the board hear what these priorities are that get selected. And I think that will be easy to implement. That's achievable for us. So I'm excited to learn questions that we did. But then my thought is the challenge of facilitating these groups, these task groups, to be confident in their work, instead of not having confidence in their choice and their expertise, which makes having 15 priorities that's kind of where I'm thinking. I don't know if Terry, I will be in the corner. I don't know. I got you. I feel you. Yeah, she's resonating with that. If you have, because when I have seen facilitators try that, you can see the disconnect from people not having the willingness or the confidence to select their priorities, and then almost this like arm jerking of the facilitator to try to get it out of that. That's not our style. But we have to achieve it. We have to achieve like real prioritization instead of maintaining the 13-page laundry list. So if you have any guidance on that, I really appreciate your answer.
Okay, so finding one of my first thoughts is, Laura, it wouldn't be you facilitating. Absolutely not. Only because if your role is to be the neutral space, but also the one that's taking, garnishing what their needs are from these different groups, then you need to be a trusted partner. So you're part of the table. Because you're also hearing, you're also saying, I want to understand better so that I can communicate forward, right? One of your guys' tagline is connecting nurses, transforming healthcare. If you just take the word connecting and transforming, part of the work, and this is time again, we think when we come together and have a facilitator, right, that by the end of the day, however long that first, we're going to have solved the problems of the world. And that's not it. The first meeting really is about building connections. You guys might know each other on the advisory board. You might know of each other, right? But for the most part, you guys know, unless, and if you're a new board, you may have heard of folks, right? You have that relationship, but also you guys have been meeting longer. When you're creating these spaces for groups to come together, you got to work from a place of there is probably zero trust, and not in a bad way. It's just they don't know. They don't know what they don't know. And they might know Clem, sorry, Clem, I don't want me to pick on you, but they might know Clem as, oh yeah, I heard of her and I don't know, right? Versus this is your time. So usually the first meeting is really about connections and creating connections with each other to create a space that invokes trust. And that's what it is. Now, again, trust doesn't mean that I'm Clem, I'm going to write, I'm going to just hand over the keys to my house to you. What trust means that I'm going to be comfortable to say things maybe that might not want to be said, but to say it in a way that can create conversations and space for those conversations. Because I might say, Clem, I don't agree with you on that. And this is why. This is from my experience. And the trust that we build in those work groups or in that task groups can help, push aside some of the obstacles, but it can also create some clarification, some accuracy in information that maybe wasn't there, but also it might allow for folks to hear things that they're like, I didn't know that that's how it was interpreted. So it's building connections, because nothing is stronger than groups that feel heard and empowered and engaged. And the only way to do that is to create the connections. And when you create connections, you create the space and opportunity to transform. And that's the other thing in your tagline, transforming healthcare. So in terms of facilitators, Laura, it's hard because it's like fit. You may think this group or this facilitator is going to be fabulous. And they come and you're like, oh, not really. I mean, great, not bad, just not what you had hoped for. But also remember that the challenge with a facilitator with your groups is you have different levels and different sectors. And so your facilitator with the leadership may look a little different than the facilitator you have with, say, the nurses or the faculty. And so you're going to really have to get a fit. And it's nothing wrong with having different facilitators, but are you going to bring them all together to say, okay, this is what we're trying to accomplish. And facilitator A, we need you to, this is your group and this is what our goals is on this, right? And so that they can recognize where they fit into the bigger scheme of what you're trying to accomplish, but then they really recognize where their narrow focus is with those groups. So, and there's trial and error. There are certain facilitators that I really enjoy working with, and I've worked with them enough to know where their strengths are, so that I'm not going to put them on or ask them to contract on a project that really isn't a fit for the both of them. Because then, right, then I'm just setting it up for it to have not be as successful as it could be. But that goes back to creating those relationships and connections around that. So I'm not sure if that answered your question, Laura, or it might just have added more like,
I actually, if I could jump on the back of that, I feel like the challenge we have is not building connections. We do that really well. I think what ends up happening is that we have so much connection in our groups that we have like, hey, these 5 ideas are all circling around and we all want to acknowledge the value and validity of 5 ideas. And it ultimately comes down to like stripping that down to what are the things that we prioritize out of these 5 ideas without compromising that trust and connection that we've built within the group, right? So it's like, how do we commit to the thing that we need to do while simultaneously recognizing that it's not what everybody in the group needs us to do? Am I making sense?
I think well, yes. And I think that's setting up clear boundaries and parameters at the beginning. I think exactly what you said is very appropriate. It's to say to this advisory group, this is what we're tasked with. Okay, we may all know each other, we may be very comfortable, but we only have 2 slots that we can take up space on. So how are we going to take our priorities and identify the top 2 when we have 7 or 5 of them? I think that, and then to say, and play on their connection if that's what's strong, to say, and I recognize that this group can, because you guys have already built connections, you guys already know the landscape, you guys already know this. So let's throw everything out and let's talk about what it is and how we prioritize it and come up with 2 out of 5 that has come up to the table or came up on the up from everyone. So I think that's okay to do, Laura, is just say, this is how we need to move. It's okay. So that's where I think for the facilitator to know what those parameters are and say, I'm helping you guys get to, because we can't throw in 5. We have 2 spaces and that's it.
If I might, everybody knows that I love analogies. And you obviously do too.
Yes, all the food analogies.
Last
I
night,
appreciate.
Friday night game with my 6-year-old was the game of MASH, like connection for house, shack or something. And but when we do this whole thing, and he was even such anxiety, just so painful for him to see he was going to get married to. But we just kept on going through it, and kept on going through the process, counting down and narrowing it, and he stuck with it. Even though it was hard, she was so committed to finding out the outcome. But I think that's kind of what you just described, right? It's like, if we have this strong connection, if we have a clear understanding of what the rules are, what the boundaries are, we can get to finding out if you're going to marry, just pretending, or what that singular priority is, because we have committed to the process and we've committed to knowing, like, all right, everyone knows they're not going to necessarily get everything they want. But we know that we will play the game the right way.
Right.
And that, the outcome may cry, but it's the process that it's so important. And crying doesn't mean like, all of these options they pick, right? They pick every single person on that list.
Right.
So all of those options are poorly
Acceptable.
It's just that the outcome, maybe the distribution of those choices, maybe will end up being globally acceptable, even though individually it's not, or jurisdiction, right? So I feel like you've almost described what public play a game on the map. But we all know, I hope I grew up amazing. I assume that everyone's has played that game.
Definitely.
But those are clear rules, right? Those are 3-step rules. You list everything you want, and then you narrow it down into the top one. And
remember too, you're not throwing away the rest. You're not. You're saying these are what we're going to move on. You're gonna leave the rest there, because what if you're able to hit those and those move? Then you can say, hey, do we want to include more because we were able to achieve things in such a way that we can, and we know that this is what people's priorities are. These are the other parts of what's available, and you guys can add things back into the bucket. So I don't think you need to throw things out or say, okay, they didn't make the cut. You just, what is it that's the top? And then you leave the rest as, hey, FYI, these also came up as needs, right? They just didn't make the top 2, or because we only had that much because we wanted to be very, intentional. We wanted to have the best push forward. And that's okay too. You want to have that. I want to know, like, oh, look at the gamut of what came out. And then to know why, right? Because the other thing people get is they want to know, well, I see that, this is over here and it's on the list, but it didn't make the top 2. Wow, I wonder why, because that is a priority for me, right? But I think from what I hear is people are pretty reasonable. They're not unreasonable if there is a rational reason why things are selected. So yeah, but I wouldn't throw more. I would put it on the side as here are the other areas that were also contenders kind of thing. Okay. And then I think that was it. I believe I'm kind of right on time. I hope. I think I am.
Like exactly on time.
Oh, ho-hos. Whew, that's a good thing. And and of course, you guys may need to kind of chew on this a little bit. And Laura, if you need to reach back out and ask questions or whatnot, I'm more than happy to help as much as I am able to. So yeah. Yes, Clem.
I like your idea about, allowing people to vent so that we can move on. Sometimes the venting can keep going. How do you stop that so that we can move on?
Okay. I think what happens is people vent when they're given space, right? Like when there hasn't been enough opportunity to be given space. So I am always a proponent of, okay, you have our undivided attention. This is the time. Let's put it all down, all the junk, ugly, blah, blah, blah. This is your space. And basically, okay, down. We've said our piece, we're going to move forward. I think, and that's part of the ground rules too, is moving forward means that we recognize junk has happened. It probably continues to happen, but that's going to be not conducive to us making progress. And that's why we made sure to give space. And that can be described in the meetings that, okay, we recognize there's plenty of baggage people carry. We're going to just give some time to chuck it up here, and we're going to move on. And we recognize when we move on, we move on. I think you have to create those, you have to say that, and you're going to have to do it in those groups, because what happens is if you take it to the larger group, then people shut down, right? People shut down. The leadership from hospitals shut down, from agencies shut down, because it's like, are we here to work or are we here to bitch? And so really, and letting the group know this is the safe space to vent. And if given an opportunity, if Clem, if you were the rep from your group to say the larger group, and say somebody from one of the organizations, say the bean counter, says, Clem, yeah, I don't understand, like, what's their biggest gripe? You might say, you know what, this is it. This is what the gripe is, and let me help you understand. And that's it, right? Then you're not rehashing, because there might be somebody who's new to the space who's like, I don't get it. I always feel like we're getting slammed. Can somebody help me understand this? And you might be like, let me take this opportunity to kind of explain to you, right? Versus if it was your team, it might be like rah, 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 and then he's just like, oh my gosh, right? So it's also being very having the gripe, taking that and making sure whoever's been at the different table can communicate challenges, concerns, issues in a way that's productive, right? The unproductive stuff all happened in the small group where you could just lay out all the junk. And then, your feedback or, you sharing things are going to be from a space of being productive so that they can understand better where, maybe what they didn't understand before. So I think it's just setting up space, Clem, and just saying, yep. Because when I've sat at spaces and people, do the whole verbal vomit stuff, a lot of it's because they never had the space. They never had the chance to, right? They had with their peers, their peer group, but they never had space with those that maybe, they saw as the challenge. And that's the thing is, so whoever from the small groups become their reps, say to the big group, what is it that if you had the time to share and educate, what would those concerns look like and how could you package it so you're not just like blasting and rehashing things that are really not productive. People just want space, and so you got to just create the parameters for them.
Thank you.
Yep. Okay, I'm going to stop sharing. Well, that's all. If you guys have questions, again, please let Laura know and she can let me know. I believe you guys have a break. And so thank you very, very much for letting me come and join you folks and have these conversations today. And I hope it was very helpful.
Thank you.
Thank you so much.
Thank you.
We will take a 5-minute break. It's 11:19, and Laura will bring us back for the strategic planning. So. Yes. Yes, nice to hear. After this, I got. Oh,
Yeah, it's gonna get possible. So, you know, I think if there's any, but we have a lot of. A lot of times. Get their son. Work out. What happened at the end, right after the, if you don't know, break it in, and then the side. That's it. You know, you were that's it for me, but I'm functioning. So you shouldn't be. If the chair doesn't understand. Like what they're doing, that's here. They didn't understand. You know, they thought that they should have trousers. Yes, have some, not everything. Like, you know, so they shop for the shirt and the inside, they don't, you never been in it. Like a child with a kindergarten. I mean, honestly, maybe be like, you know, like that, that'd be. That's fun for me, and I'm not. We have several chairs saying something. So smart. So big. Everybody's gonna need to.
Well, you could.
Okay. Can you hear me?
Yeah.
All right.
Yeah.
Oh. Okay, so we are going to do. Actually, can I? Go to the link? Let's see, I'm gonna go to the link and maybe or do you want to share screen and take notes, Bree? Great. All right, so we are going to go into our priority setting activity, and I am going to, can you give me permission to share screen? So in everybody's packets, if you want to go into this, if you have your devices, you can go directly into it. We are going to do a very fast priority setting based off what Sherry had let us, or based off of the information that Sherry shared with us today. As soon as I get permission to share. But what we're going to do is we're going to talk about three things. One is the 2023 priority setting. If we, so how we want to address these three activities, a 2023 priority setting, if we want to look at our mission and vision and make sure that it is what we think represents us, or if we want to address it, and then how we want to address our strategic planning goals. Obviously, we don't have time to do all the work today. That's not the point of today. Today is to help us think about how we want to set up our agenda for our November meeting. So this is our agenda setting for a whole meeting and more meetings to come, right? So this is like Sherry Daniels gave us the first conversation. This is putting onto paper how we want to have our second conversation. Okay. So here we are. The first activity, and for the people in the room, because we're having sound issues for our online attendees, I'll just repeat things that people are saying. For number one, 2023 priority setting, are there any thoughts? Do we have any key attributes? Do we have any goals, quick goals, needs, challenges, or opportunities that you want to tackle? What do we want to do first? Do we need to have these subcommittees provide feedback to us before we do priority setting? Do we want to look at what we've found today, what I shared in the outcomes, and like pick those priorities from the overview I provided? What would make you feel capable of setting priorities when we meet next? Okay, so hear from the subgroups. Okay, so we need to do that. Anything else? Is that, and if that is the number one thing, we can move on to the next activity. It doesn't have to be that, you know. What do you need in order to do priority setting next month? So we have a wellness, recruitment, and retention subgroup. We have a clinical placement subgroup. We have a nurse residency program collective. We have evidence-based practice. So we have all of these initiatives. Simulation, APRNs.
Where's the faculty?
Faculty is, we are couching it under nursing professional development. And we have we have that faculty convening of conversations with students as well. Carrie is actually like draft almost ready to be finalized about our faculty workforce. We also have some new perspective of our existing data that will be available for your consumption before those meetings. Okay. Okay, so the answer to that was information about who the task forces are and what they are doing. Okay, so we can do that before our next meeting. So we can give you that information about who they are, what they're doing before the next meeting, and we can hear from the subgroups, I think, before November. We're at that point where we're ready for most of that. Does that make you feel good? Okay. Oh, and chats, let's see, prioritize 3, we want to prioritize 3 items. Is that what you're saying, Clem? Only 3 items. Okay,
Does items mean task force? or
is that task force? Yeah, can you clarify? Catherine is saying, what does 3 mean? What is the subject behind 3? Is it task forces? Is it individual priorities, individual items?
Those items that you had talked about, wellness, what was it?
Okay. Of wellness.
Utilization of the workforce.
Okay. And then we have from Roberta, learn about unfinished business. And what is going forward into next year. So essentially, like, what can we not draw? All right. Let me see, did I miss any other? Okay. I'm gonna move on to the next one. So our mission and vision, and I'm going to apologize because I know this is small, but I'll read it out. That I filled up my entire chat. So our vision is to be a champion for nursing excellence and trusted collaborative partner, developing a healthcare workforce committed to the promise of quality care for all the people of Hawaii. And our mission is through collaborative partnerships. The center provides accurate nursing workforce data for planning, disseminates nursing knowledge to support excellence in practice and leadership development, promotes a diverse workforce and advocates for sound health policy to serve the changing healthcare needs of the people of Hawaii. So I will disclose that I feel like these need a little bit of tweaking, and so I would advocate that we address this by a subgroup. So that's my advocacy moment right here. But you all need to have an agreement about whether we take that up as a subcommittee or not.
That should be a nice short.
Yeah, I think that's a fast deliverable.
Let's just work.
Yeah. No, it's not that long. I think it's wordsmithing. Yeah, it's unwieldy. It's a lot.
But I don't get wrong. Like I don't, that is much more than you. Acceptable is a better word now, but if we read the. Yeah, I get that in reading. A lot of verbs.
Okay.
I don't get it.
Okay. I mean, I think that's the challenge, right? Is that, oh, let's say that the current text is unwieldy and we are not unwieldy. All right, and then the next, can I move on? All right, great. And then the strategic planning goals. We heard today, Sherry made recommendations that we pick 1 or 2 priorities over 1 to 2 years. We're already talking about 2023 strategy. But then we also have to think about how we tackle strategic planning and setting those goals moving forward. I don't know if we need to, so the things that I don't know is, I don't know if we need to make that choice in November. We have a whole year to kind of figure out how we want to land and develop. We don't need to act in crisis for this. We can plan this out. But we need to consider how we want to take on this task because we are coming to the end of our strategic goals and we're coming out of a very turbulent period in nursing workforce and in the world. So does anybody have any thoughts about how we address strategic planning? Like, do we want to get through, where's our comments, Bonnie? Were you gonna say something? Sorry. Okay,
I agree with Bonnie's suggestion that we can get a report from the subcommittee and then use that as a basis to focus the discussion and choose what they will down. If we have two or three things, maybe we can really productive. We'll have to think about or and we'll be getting to do next. I think for November, it makes sense to start with the open part, so all of us get our heads. For a while.
okay,
I think it would be important to make sure that you have good facilitators of those subcommittees so that they are aware of expectations and do come up with what we're asking them.
Convening of the committee. Strategy?
No, I don't think that's.
Yeah, their work,
Yeah, they have to.
So they we just know
what they're
where they
doing.
are.
yeah,
If we want to go.
Okay.
That's
need the sub priorities. All right, and then it's forward, yeah. Okay, and so, yeah, Bonnie was reiterating what Clem said and said that we already have this subcommittees, we need to learn what their priorities are, and then moving forward, we need to have good facilitators to kind of continue and guide that work. Okay. So that's the whole activity that we had planned. I promised you it was short. We don't, we can't tackle, yeah, we cannot tackle, but I think we do need a vote that these three, that we have a motion to proceed with these actions, so we can plan that next agenda and form that subcommittee. The mission and vision subcommittee.
Sorry, asking for.
Mhm.
Yeah.
Yeah. Well, we only need a motion for the subcommittee, because that would need to be formed. The priority setting, that work is already happening and it's outside of our advisory board, so it is community-based work that can report, and we can put that into agenda form and have those reports ready for you by next meeting. So we don't need the votes for those two items, but we would need the vote for this subcommittee.
Okay, I move that we form a subcommittee to. Look at and revise.
Okay, Anne made a motion, Bonnie seconded, and then Anne, I think you're supposed to call for a vote.
All right, so all in favor, raise your hand on Zoom or in person.
Okay, and let me move to stop share. Glenn has her hand up, Roberta has her hand up,
Everyone.
Gloria, Rose, Bonnie, Linda, and Anne. And those are our voting numbers. Ayes have it.
Ayes have it, motion carries. Yeah.
Ayes have it, motion carries. All right. Well, as promised, that was a short and sweet strategic planning, because that is only the beginning. Thank you so much for that vote. And then at this time, we are going to be pivoting to our service and our service and recognition. And we have one of our very esteemed people here, but we'll also take the opportunity to talk about the other folks who have just been really wonderful to our nursing community over the years. So with that, let's lead with our present member. And Bonnie, you have the honor. Why don't we have you guys come up and move Well, come up to the front and then I'll move the mic so we can hear. Yep, and Representative Yamani, if you can have me come up back.
So do I need to carry this? Yes, I guess so.
It helps us in the room. The camera's there, so if you want to aim your face at that camera,
Okay.
or Zoom folks can see you too.
Okay, aloha. All right. Yeah, that's a nice thing. Okay, so last year, the Hawaii State Center for Nursing launched an initiative to sustain the Hawaii State Center of Nursing. As the vice chair of the Hawaii State Center for Nursing, I led the initiative that looked at the value of the Hawaii State Center of Nursing and investigated strategies to ensure sustainability of the center. The goal was to sustain the center's work towards the mandates and ultimate drive to support public safety by ensuring a robust nursing workforce across the Hawaii Island. Seeking the champions of the legislature was critical to ensuring that the center would sustain our workforce research, strategy, and program support to the state. Our next two champions were very critical, and without them today, the Center of Nursing will be looking at the future. In short, you have given us the gift of time and in response, we commit to our mission to ensure our state has accurate workforce data for planning and can access nursing knowledge to support executive practice, leadership development, builds and sustains a diverse workforce. I'd like now to acknowledge Representative, Representative Shamani, who has facilitated further conversations on how to improve access to healthcare by ensuring interpersonal efforts are elevated and celebrated. As a healthcare professional himself, he has an important role, both representing healthcare professionals and guiding policy that supports access for care for people and elevation of practice for healthcare professionals in the state. Identifying the need to expedite recruitment and retention of nurses, Representative Yamani introduced Bill HB 1758, which was signed into law with Act 203. Yes. So the bill will support foreign nurses seeking to enter the Hawaii workforce. Thank you again for identifying the need and the solution. Representative Yamani, thank you for your service to our state.
Thank you. Good.
Yeah. We come with more than words.
Oh, my goodness. Oh, wow.
So we gave,
Oh,
you gave
my
us the gift of
goodness.
time, so we're giving you.
Oh, wow.
Thank you so much.
Oh, this is awesome.
Yeah.
Oh,
And
thank
we're
you.
so honored and grateful for your advocacy.
Wow. Can I say something to the nurses?
Yeah.
Sure.
please.
Oh, so, well, I don't want to drop this. But, first, I wanted to say thank you for acknowledging us. I know you have others like Governor Hige and my counterpart in the Senate, Senator Paul over there, Jared. So, you know, for us, we wanted you guys to know that we truly believe that all nurses are heroes, right? So my background is, you know, I'm a social worker, but I work hand in hand with nurses at Queens. I was one of those social workers that opened the family treatment center. So I work with psych nurses at Queens, Camp 2. I also worked with them in Coachella. Then later on, I went back to Queens, became a floater, and I worked all over the 10 OBGYN, all the way down to you know, the various units. And then I worked in Strong through HPA. So I just wanted to let all of you know, and those on the line, is that, you know, nurses, many of us, we know you're in the front line. You deal with patients, you deal with families, you got to deal with other medical professionals, sometimes grumpy docs for morning and afternoon rounds, right? And so I formed a very fond relationship with my nurses because we both get yelled at, right? So you guys get yelled at for something regarding the medication, and then I get yelled at because I didn't get the patient out of the hospital. Right? But I just want you to know that I took that teamwork and all that learning because for us on the floors, right, and out in the community, we work together, right? When I worked at Department of Health, I worked very closely with the public health nurses. Because together, we help not only our K team, but we help our Kapuna and everybody in between. So on behalf of the state, I wanted to acknowledge all of you, what you're doing, the center, as well as all the nurses, wherever you are and whatever you're doing, that you play an important, vital role in our community. So we actually should be thanking you and extending all of our support. So I just wanted to say that to let you know that the word hero is not just thrown out to you just to say because of the pandemic, but my thoughts of you being heroes went decades before, because together on the floors, we actually saved lives, we improved lives, and sometimes, unfortunately, together we had to tell families that it wasn't going to be the right outcome. But never once did I see nurses or my counterparts in mental health turn away families. You know, we were there no matter what, even if you know. So again, on behalf of the state, I wish they were here to acknowledge that as well. That we wanted to thank all of you. And you know, those that are participating in a strategic planning, it's very important. Because it's not just going to be a problem for the next year or 2 years. We're talking decades with the labor shortage, with the public health emergency order ending probably early January, which impact all direct care. Some of the changes in Medicaid would again impact some of our long-term care facilities. So the spectrum of our safety net will be impacted. So again, this is going to be challenging times, but I think great opportunity for nurses to shine. So again, thank you for this honor. Sorry, I didn't mean to talk.
They give the other recognition to the.
Okay, I'm gonna recognize Governor Egan. So since 2018, the Hawaii State Center for Nursing has made efforts to become more visible by providing more accessible data related to the nursing workforce and improve access to strategies and evidence that support a strong nursing workforce. In 2020, with the coronavirus coming to our state, we did not welcome that. And becoming a global pandemic, we learned just how important evidence-based strategies are to ensuring a strong and robust workforce. Our first champion took swift action ensuring access to nurses, both by creating waivers for recent grads from nursing schools to being able to work in state without a license, so they could be immediately be able to work while securing their initial license, as well as enabling retired out-of-state or formerly licensed nurses to work in the state. This champion also identified critical needs in nursing education and allocated 39 new instructor positions and professional development support for these instructors. This will critically impact our UH schools' ability to enroll and train new nurses at a time that we desperately need them. As the former chair at Maui College Nursing, I can attest that the grant impacted the nursing student waivers impacted the hospital, as well as increasing the instructors right now for our state. So it's with great pleasure that I thank our first nursing champion, the Honorable Governor Egan.
And I just want to recognize our other three champions who are all traveling today. So we didn't get them before they secured their travel plans, but I want to also recognize Dr. Nancy Atmosphere-Walsh, Beth Hogan, and Susie Lee. So Nancy Atmosphere-Walsh, as we, I think, are all very well aware of this way, they gave an endowment to the UH Manoa School of Nursing. And in doing so, it was renamed the Nancy Atmosphere-Walsh School of Nursing. This is so incredible in its own right. She is the first person on the UH Manoa campus, as I understand it, to have a school named after her because of a financial endowment. Who is also a woman, who is also a nurse, and who is also an immigrant. And so I think that we can see that she not only has achieved such incredible accomplishments and is so giving, but also really embodies so many of the different sections of our workforce and has committed back to the profession. And specifically, in her endowment, she also supported the operations of the Boise State Center for Nursing. And so we are recipients of her endowment, as well as new faculty who are engaging in their initial scholarly pursuits. The children of Hawaii through supporting the Hawaii Keiki program and supporting scholarships for underrepresented students. And so, you know, I saw Nancy last weekend. She was at the Health Workforce Summit, and she told me, you know, I've been talking, and I think we all know that she just is like a bundle of energy and a bundle of ideas. She's like, you know, I've been talking to people, and I'm starting to plan what my next step can be is that I want to see. And you know, you can't not recognize someone who only sees opportunities to give back, and that is really Nancy. So I want to recognize her. The second two are Susie Lee and Beth Hogan. And they're particularly special advisory boards, not because anyone else is in here, but they actually did 10 years of service. They were on the advisory board for 10 years, which is abnormal. They kind of kept on. There was shifting of how the advisory board members are secured, and they were remnants of a previous structure, but they committed to us. And it's so important. Susie recognizes, she represented the nursing union. She also represented long-term care. She also represented employee health. She represented wound health. And she was one of our strongest champions for helping us articulate what the value of continuing professional development was. She was critical in our success, both in launching that initiative to get it passed into state law, and then articulating how to be successful nurses so that that was a supportive activity and requirement in the community. So I really want to recognize her because she understood her role and her value, as Sherry was talking earlier today, and brought that to the thing. Beth Hoban is the second board member that has just an incredible length of service for the Center for Nursing. She is she represented not just nursing, but she represented being a business owner. And that was our first nurse that we had as a business owner. Bonnie now is also represents that. But helping us understand the financing and the challenges of nursing outside of an acute care setting, helping us be connected to other small nursing organizations. She fostered our relationships with long-term care, with hospice, with home health. And she also articulated the value of the center nationally and locally by being our co-lead for the Hawaii Action Coalition from its inception, which is an initiative to help other people understand the value of nursing and to foster those relationships and start a collaboration. And I think because we all know Beth, right? I believe we all know Beth. I think we can all recognize that her true talent is making people who are not healthcare workers understand nursing instead of just appreciating it. And so I want to recognize both of them for their incredible years of service. And I so often have called them and asked for insight or advice, particularly when I was starting out as a director. They were both beacons of hope and sources of counsel. So they were just really incredible board members, not just for their length of service, but for the value that they contributed during their service. So I want to recognize them specifically. And with that, I believe that we can now celebrate each other by having a break, which is lunch.
Okay, we're gonna adjourn for lunch.
Oh, it's like.
I see what you're saying. So I what you're saying, I'm not ready. I feel. I think you have to go now. I have, we asked that question, I don't think it's all. But there was. That's how the word gave them like. It's rain. Are we starting to pay now? Yeah.
And then, like, it's like, you just have to go like, nine, quality, have a big budget. But it's one day. Wow.
Some states have different property. Other levels. Ask people, you guys, say, well, I see that we have CCA and school of marketing, so we have very always. Yes.
Right. That would become valid. Yeah. So basically, so the difference is that basically, you like pay, so the goal was. But on the top, that's. See, that was. Process. I cannot. Very well plus three. From the big guy.
Well, I think so. Explain through some of the. Yes. It reduces Well, they don't have essence. Yes. You know, and I. You know, well, it's work. I was bringing. Hey, everyone, thank you. Thank you. Thank you so much. Oh, no, no. Oh, okay, I'm sorry. Yeah, Kristen would love that, because I don't do that very well. This all, I can do more. But yeah, thank you so much. You guys, yeah, you guys do so much for us. Yes, when I see, I think I might see those people. Yeah, those people. I'll mention them. Okay. Oh, okay. Oh, okay. That'd be great. Thank you. Bye, everybody.
Oh, and I want to. I did. Sure. Bonds of joy. They are very. Oh, the ones my niece had. Like dinosaurs and. Yeah, I understand. There's not situation. You're sitting. Actually, I just have to hear you. That was a very vivid description, yeah, that's true. But I don't think that was. And say. You know, maybe I'm not.
Right, so we just go outside.
That was one of the things we were talking about. I first went to Tennessee, my parents and I, we rented a cabin in Gatlinburg. It was summertime, but still, I was imagining that. And I was imagining that in the snow, like in the Smoky Mountain snow, sitting out there, like 30-degree weather. And like that. Yeah, we did it. No, but I really.
Then you're standing at the door.
We have to kind of. But then, yeah. Yeah, whether you're whether it's not really on. Nancy had her son, she was a gigantic, such a gigantic. Muscle. You put the bed. Unicorns in it. I mean, clearly you don't know that part of the thing. Yeah. Working.
But you don't get to follow. Sure. No, exactly. Take this like here. Security. I know. Feel like we need,
We just have to do evaluation with them.
gosh, is that it? Yeah.
Get to that.
Okay, we gotta do our evals, sisters.
Okay.
We have to what?
Move Carrie out.
Fine, set it up. Why are we trying to do a picture?
What have you been? I gotta make a recommendation. Yeah.
I love to eat. Yes. Okay, you guys, we gotta do this evaluation. It is 12:51. If you look on the, inside cover of your folder, you can do it there. Or how the guys online gonna do it? Oh, there's a survey link there. Clem and Roberta, you can do it on there. So just take 5 minutes and do,
I think you're ready.
we'll tell them that. Not long. Okay.
Very smart. It's a different picture. They don't search the thing, find it. Right there. Tyrannosaurus. Google this stuff. Yeah, because all the Googles, I don't know why, but all their QR in the next.
Last night, I mean, like after my last stage, I think it's right. Yeah. Every time we have like this.
I feel like that's not an inaccurate description.
Okay, I think we're done. Can I have a motion to end the meeting? Okay, Linda? Thank you, Rose. The meeting is adjourned.
Thank you. You know, we could put one of these on the. Tripod.
The camera. Or what help do you need doing anything?
Okay, my friends and colleagues, our job is to stand at this wall
And take a picture.
and take a picture. Please take your badge off because that is the most good picture. Well, we're also Okay.
Photograph. I'm not. Okay, good. That's a lot of responsibility.
We also have. It's the wall for.
Like a mugshot. If there was a yardstick on the thing that you guys will. It would work. You guys could stand.
She looks scared. Actually, she came from somewhere. Yeah, so. Have you ever heard all of them? There's a lot of
Desperately get out of Bree's way.
Desperately get out of my way.
I'm trying desperately to get out of here with everywhere I go, you follow.
Say cheese, everyone. Cheese, everyone.
Oh, yeah, this, ooh.
I'm so funny.
And I think I got it.
That seems weird because now you're not in the picture.
Very good. Not gonna harm you.
Can you put a picture of us? Should we have a jetpack?
Are we switched now?
Are we?
Here, what do you lay down on the floor?
We're not actually.
Is this Rachel's way? Is this Rachel's way?
We actually,
Just so that we can.
you can switch it if you prefer.
No,
Okay.
yeah. Yeah. I think that-
All right.
There's no need to squat or bend or lay on the floor. mean, you know, whatevs. Probably better anyway.
I was gonna clean up after myself.
Right.
Thank you.
Okay.